36-year-old female patient, Tandy, is brought to the emergency unit by her friends. They were at a nightclub where she started getting ill. She did not take her chronic medication with her, and she tried so many times to convince her friends to drive her to the hospital, but they just wouldn't listen as they continued to have fun. Despite the worsening of her symptoms, her time to be taken to the hospital was prolonged from 9 p.m. to 3 a.m. Tandy is a known asthmatic patient who has had multiple emergency unit visits and also hospital admissions. What could have been the reason for her previous multiple admissions, and also why is she presenting to the emergency unit again? Hi, you are watching ED Files, and I am Dr. Thabo Mafa. In the emergency unit, status asthmaticus is one of the common cases that we see. Small children, teenagers, and even adults, if they are uncontrolled or at some point exposed to an allergen, they can find themselves in a situation whereby there is exacerbation of this airway disease called asthma. So the question is, what is asthma and what is status asthmaticus? Asthma is a chronic inflammatory airway disease that can be characterized by symptoms such as a cough, tight chest, and wheezes sometimes. This condition cannot be cured. However, it can be managed with drugs such as bronchodilators and also corticosteroids. On the other hand, status asthmaticus is an exacerbation of an asthma disease that does not respond to the initial treatment with bronchodilators. It is a medical emergency, and if left untreated, it can easily lead into respiratory failure and sometimes death. If you are an asthmatic patient, what are the things that can put you at risk of having an acute severe attack? This we call status asthmaticus. There are a few things like respiratory tract infections, especially if it's lower respiratory tract infection. It can be in a form of bacterial infection or viral infection. Air pollutants such as dust, smoke can easily trigger an asthmatic attack. Cold temperatures, exercise, medications such as dispirin or non-steroidal anti-inflammatories can do the same. And use of recreational drugs can also do just that. Let us now talk about the pathophysiology, or in simple terms, what are the cascade of events that take place for a patient to have an acute asthmatic attack or status asthmaticus. There will be several changes that take place in your airway, like inflammation and swelling of your airway. There would be formation of mucus plaques in the airway, followed by bronchoconstriction. And because the airway is now narrowed, there would still be circulation of blood to the lung tissue. However, the oxygen that's supposed to be distributed to your body parts cannot be distributed because it is not able to cross the barrier between the lung tissue and crossing over to the blood. That would lead to hypoxia, that is low oxygen saturation in your body. An allergen exposure causes a release of chemicals or mediators such as eosinophils, mast cells, and interleukin that trigger an inflammatory response in your airway, and that would result in a cascade of events that we mentioned above. As a clinician, what are the things that you need to ask when a patient is, if you come across an asthmatic patient and you want to assess if they are being controlled, or what are the risks that they could easily go into a status asthmaticus? You need to know if the patient has had episodes of severe shortness of breath, which were quite frequent. And these episodes sometimes would take few hours and also a number of days before the patient goes into a full status. You need to find out if the patient has had previous intubations that were related to asthma. Did they have multiple hospital visits or admissions? You also need to know if they've got a history of use of systemic corticosteroids. The reason why we need to assess these patients properly is if these questions above are not being asked and the patient is not being assessed properly, we are more likely to undertreat them, and we may not follow them up frequently, and that would put them at risk of going into acute exacerbation of the asthma disease. Patients with asthma, whenever they've got an acute exacerbation, tend to present with classical symptoms, and they are a cough, shortness of breath, tightness of chest, and also wheezes. Now, there is Tandy, and we are examining her. What signs are we more likely to find in this patient? She is in respiratory distress, meaning that she is in severe shortness of breath. There is wheezing when you listen to the chest. Or sometimes, in severe cases, they could have what we refer to as a silent chest, meaning that there is severe bronchoconstriction or a closed airway to a point whereby you cannot even pick up any wheeze. She struggles to speak in full sentences because she has to take breaks in between due to the shortness of breath. Her chest is hyperextended or overinflated because, remember, in asthma, the main problem is taking air out than taking air in. So most of the air is trapped within the thoracic cavity, within the airway, that makes their chest to be overexpanded. When you check the blood pressure of a patient who's got a severe asthmatic attack, status asthmaticus, one of the indicators of severity is the blood pressure. If during inspiration and expiration the blood pressure difference is more than 15 millimeters of mercury, then definitely you would know that this patient needs urgent help. They would use accessory muscles of breathing, such as intercostal muscles, sternocleidomastoid muscles, and scalene muscles. And when you do their lung function test, you find that there is significant impairment, that their lung function test is less than 60% of what is supposed to be. And again, on examination, some patients may have an altered level of consciousness. And whenever you give them oxygen, sometimes you find that their oxygen saturation still remains below 90, irrespective of how much oxygen you're giving to them. Some of them can go into respiratory failure that would eventually require intubation. How do we then investigate a patient in status asthmaticus? Do bloods to check your arterial blood gas. Check if the patient is retaining a lot of carbon dioxide and also their oxygen levels. Check for acidity in the blood. Do a full blood count, which would indicate the infection marker on it. Like as we mentioned, an asthmatic attack can be triggered by lower respiratory tract infection. A higher marker, infection marker, would suggest that most likely that could have been the trigger and you can treat accordingly. You also have to do a kidney function test, a CRP, which is an inflammatory marker. That would also give an idea that there could have been an inflammatory process that triggered the asthmatic attack. Also, check the status of your heart, a pro-BNP. This would tell you if there is any congestion within the chambers of the heart. A patient who's got heart failure can present just the same way as an asthmatic patient. On a chest x-ray, look for signs of lung infection and other things such as a collapsed lung. A patient who's got asthma, and if it's not resolving on time, they can easily get a lung that collapses, and this we call a pneumothorax. Do a spirometry, that's a lung function test, and also do an ECG to have a look at the status of the heart. How do we then treat Tandy, who is in status asthmaticus? We gave her bronchodilators, and that is medication that would open up your airways. And in an emergency, we use nebulization. Give them corticosteroids to reduce the inflammation that's happening within the airways. And sometimes in clinical practice, what we do is we give these patients magnesium sulfate, as we have observed that they respond very quickly when they are given this. If you suspect or you have confirmed that there is lung infection or airway infection, you need to treat accordingly. If it's bacterial or viral, you have to treat according to the findings that you have. Do not forget to give these patients supplemental oxygen even after nebulizing them. As we have mentioned, asthma cannot be cured and it cannot be prevented. But status asthmaticus can be prevented somehow. What do? We need to educate patients about the triggers that the patient is more likely to be exposed to. We need to have regular follow-up care, and we need to be able to identify the triggers that are likely to exacerbate or worsen the asthma condition. We need to teach them to be adherent or compliant to their medication, and also teach them how to use the asthma pumps properly. You have to avoid stress triggers, and also, most importantly, avoid smoking if you are asthmatic. You have to make sure that your pets are clean. Get rid of the dander that you would find on your dogs, your puppies. And also, make sure that your carpets in the house are very clean so that you don't end up with dust mites that would irritate your airway. Now let's talk about prognosis or in simple terms, chances of survival if a patient has got status asthmaticus. Patients who are treated early and appropriately stand a very good chance of surviving. However, if they've got other illnesses such as chronic obstructive pulmonary disease or congestive heart failure, it might be tricky sometimes to get them right. What about mortality? These are the contributing factors. Delayed treatment, comorbidities like the ones that we mentioned above, smoking, or previous intubations related to asthma disease, and also uncontrolled asthma can affect the prognosis of the patient and can lead to higher mortality rates. What are the things that can go wrong, or what are the complications in status asthmaticus? These are the possible complications, but not always. A patient can go into respiratory failure, meaning that they get tired of trying to breathe. The respiratory muscles stop working and they stop breathing. They can go into cardiac arrest, and the same thing happens. The heart muscles stop beating. They can have a pneumothorax, a lung that collapses, and there will be air filled within the thoracic cavity. In these cases, these patients would need a tube that goes into the chest to relieve the negative pressure that is on the lung. A patient can have brain damage due to lack of oxygen that has to be transported to the brain. They can also have toxicity to medication, because if the patient doesn't respond to the medication whenever you're trying to treat or manage this asthmatic attack, you can end up giving them higher doses than they actually require, and that would put them at risk of being toxic from these high dose of medications. Patients who are intubated can sometimes get lung infections from the ventilators they are connected to. And in some unfortunate cases, a patient can die. What are the differential diagnoses, or what other conditions can present like an asthmatic attack or status asthmaticus to be appropriate? Anaphylaxis is one of them. Congestive heart failure, aspiration, a patient who's got a bad reflux, acid reflux, or is vomiting while they are sleeping, could have the food content going into the lungs, and that we call aspiration. And this would give you symptoms that are similar to an asthmatic attack. A patient who's got bronchitis, in most cases, can be mistaken for an asthma disease. Chronic obstructive pulmonary disease can also present the same way. And now, perhaps you are asking yourself, eventually, what was the outcome? What happened to Tandy? Tandy had status asthmaticus, which was probably triggered by the cigarette smokes she was exposed to at the nightclub. But even though she came to the hospital 6 hours later, she responded very well to the medication that was given to her. However, she had a collapsed lung, a pneumothorax, which we had to relieve using a chest tube or an intercostal drain. Her hospital stay was quite longer than it was supposed to. Only if she presented quite early, she would have been discharged much earlier. And now, in conclusion, early recognition of the signs and symptoms of an acute asthmatic attack, and also commencement of treatment as soon as possible, and being able to identify triggers that can lead you to an asthmatic attack or status asthmaticus, and also avoiding them can save a patient's life. Thank you very much for watching.